Hello, I'm Dr. Lynn Vong. I'm a board member of the Hackett Hemwall Patterson Foundation. Our organization began in 1969 in an effort to bring medical care to the underserved communities of Honduras. Since then, the organization has expanded to provide service learning trips to other countries to treat chronic pain and alleviate suffering. I'm here today to interview Dr. Richard Owens, the founder of the Vein Care Clinics in Honduras for HHPF. He was the director of the program from 2003 to 2018. Thank you, Dr. Owens, for being here today to share your story. Can you tell us, how did the Vein Care program started?
Thanks, Dr. Vong. It's really a pleasure to talk about the Hackett Hemwall Patterson Foundation. It's been one of the bright spots of my entire professional career. I first met Jeff Patterson when he showed up at my office unannounced in late 2002. And within 15 minutes of introducing himself, he had convinced me that I should join him and a bunch of other volunteers on a Central American service mission trip to take care of poor people who really needed my help. I was amazed by how fulfilled I was by the experience.
Can you tell us what happened on your first service learning trip that made you want to come back year after year?
We began with a couple of days of classroom orientation sessions, meeting the other volunteers and learning the techniques we'd be using and the supplies available. And then we set up our temporary clinic in a large room at the local Red Cross office. And Monday morning we showed up to discover that the courtyard of the Red Cross building was absolutely filled with people. Hundreds of people had shown up after riding hours on buses. Some of them walked for an hour or two before they got to a paved road where a bus was available. But they had made great efforts to arrive on this date at our clinic for us to take care of them. We saw some of the worst vein care problems I had ever seen or imagined. After disguising my feelings of being overwhelmed, we welcomed the first patients in and we began treating. It was really striking that these people were putting up on a daily basis with suffering that nobody in the United States experiences without getting some sort of help.
Wow, sounds like that was a lot of work for you also, to be able to take care of all of those people.
It was very much an exhausting first day. In the evening, Dr. Mark Timmerman, a good friend who I had met also that week for the first time, said something at supper time when we were both almost too exhausted to chew our food. He said, "You know, this feeling right now, this is why I went to medical school." And I thought, yes, exactly. This is a great feeling.
Wow, that's awesome. You echo and mention the same feeling that we all have when we participate in these service learning trips with HHPF. Thank you. Can you tell us what type of services you provide for them?
At the time, a newly emerged technique had been described at the last professional meeting I had been to, and so I brought it with me to Honduras. It was called foam sclerotherapy, where a very small amount of medication is drawn up and converted into a foam, which is injected into the target varicose veins, and over the next few days, very harmlessly and very safely, scars shut the targeted varicose vein. This was very effective for relieving the pain, the suffering, and it also turned out, and we were able to even document and publish this, that it cures the ulcers that result from this longstanding varicose vein problem. Open ulcers that people had had for years were closed within several weeks after the time that they had a single treatment at our clinic.
Wow, that's very awesome. We're able to bring then advanced technical care to people that couldn't otherwise afford that. I understand that the HHPF vein clinics have now expanded to have 3 sites in Honduras as well as one in Guadalajara, Mexico.
Yes, we've been very blessed with eager volunteers, both locally and internationally, who step up and work hard and thank us for the opportunity afterwards. We're very blessed to know each other.
Wow, that's an awesome way to bring the community together. Thank you for your contributions to making the world a better place. Do you have anything else you would like to share with our viewers today?
I'll just say what I was often saying to the doctors at my national meetings when I would introduce the topic and try to recruit new volunteers. How would you like to have the secret for instant wealth? And it goes like this. You go to a poor country where people have almost nothing but terrible problems, and you treat them and work hard to help them with their problems, and you charge nothing. And when you're so tired you can hardly stand up, you go back home and you look in the mirror and you feel like $1,000,000.